Network. I'd like to welcome you to today's webinar, Setting Yourself Up for Success, Study Strategies, Healthy Habits, and Meeting Mentors. My name is Laura Turner. I am the Executive Director for the Health Professional Student Association, which is the publisher of Student Doctor Network. And with me today is Dr. Kokar from Osmosis.
Hello, everyone. Thank you all for being here. My name is Mamouna Kokar. I'm the Director of Clinical Curriculum at Osmosis. It's a real pleasure to be here. My background, just quickly, is I'm a general and endocrine surgeon and a former clerkship director.
Thank you. We have a few objectives for today's webinar. The first is to discuss learning styles and learning strategies so that you can learn how to study more effectively. The second is to talk about health and how healthy habits can improve your ability to learn and do well in your academic pursuits. And finally, we're going to be discussing mentors, how you can meet them, how you can build those relationships. And we'll close out with a session of Q&A at the end of the webinar. So right now, I will go ahead and turn it over to Dr. Kokar for the first section of the webinar, which is going to be on study strategies.
Excellent. Thanks, Laura. So we're going to dive into study strategies first, and we want to try to make this a little interactive. So we're going to begin each of our topics with a little poll. So I think we are going to launch our first poll here. And our question to you is, how many of you have identified your studying style? So I'll just give you a little bit of time here to just send in your answers, and then we'll take a look at what the trend is here. All right, perfect. And let's see if we are able to see the results of the poll. All right, it looks like we have a little bit of a split here. About a third of you said yes, absolutely. 20% said, what is that? And about 50% answered, no, not yet. So that's good. Hopefully then this will be a little of value to everyone here. So let's move forward and jump into talking about study strategies. So medical learning really involves a really large volume of very fast-paced information, and it's really not siloed, right? Everything builds on each other and it demands recall. So it's no surprise that it's often described as trying to drink water from a fire hose. So a key component to trying to be successful here is learning how to learn. So that means how to synthesize and retain knowledge for the long term. Luckily, just like there's evidence-based medicine, there's actually science behind learning. So learning science is defined as an interdisciplinary field that works to further scientific, humanistic, and critical theoretical understanding of learning, as well as engage in the design and implementation of learning innovations and the improvement of instructional methodologies. Now that's a real mouthful, but for the purposes of today's presentation, we're going to really be looking at the learning science behind learning styles and learning strategies. So we can move to the next slide here. So everyone approaches studying medicine differently. Everyone has a specific learning style and learns best when information is presented to them that way. So we typically define and categorize learning styles by a sensory approach. So you can be visual, oral, verbal, or kinesthetic. So a visual learner is really going to learn best when they see concepts. Oral learners learn best when they hear about them. Verbal learners really thrive when they read and write about topics, while kinesthetic learners really thrive when they have hands-on experience. You may also identify as either a solitary learner or a social learner. So you may learn best when you're working alone, or you may learn best when you're working with others. So for example, maybe you really do well when you learn in a study group and then move on to independent studying, or vice versa, or one or the other. The important thing to mention here is you may not fit into just one category, and that's okay, and that's normal. And the other important thing to mention is that your learning style can actually change with time and with circumstance. So, for example, what works really well for anatomy may not work so well for pathology, or what works really well for your preclinical courses may not work for clinical rotations. It's really important that you revisit the concept of what your learning style is as you progress throughout your education. We can go to the next slide. Just like there's different learning styles, there's also various studying styles. So people have really distinct needs and methodologies that they use when they're studying. So Osmosis actually developed a quiz which categorizes learners into one of 4 study personas. So you could be a cherry picker, you could be a completionist, you could be a coursework crusher, or you could be a wheel spinner. Now, each individual has needs and motivations that are unique, and they face different challenges when they're studying. This quiz, by identifying those needs, motivations, and challenges, will categorize you into a studying persona. And then it's going to construct an action plan for studying that's specific for that persona. Another important thing to mention, though, is just like with learning styles, your studying style can change with time and with circumstance. So if you use tools like these, you want to revisit them again throughout your entire educational process. Another really important thing to mention is just identifying your learning style or your studying style isn't going to magically, in and of itself, make learning more effective or efficient. That's really where the learning strategies come in. So that's what we're going to talk about next. So how you study is as important as what you study. So today we're going to talk both about general and specific learning strategies. The first general strategy I want to discuss is to understand and to utilize what's called the study cycle. It's depicted here for you. So I want you to take a 5-step approach to learning. That means preview material before your classes, attend those classes, then review that material afterwards and study that material. The final component is to assess the effectiveness of that study strategy that you just used. Now you can see that each one of these steps builds on the previous one, and each one individually is a really important part of the learning process. If you use the study cycle, you'll be able to break up or segment your learning into chunks or pieces, and that way you'll end up actually learning more effectively. And we can go next slide here. So speaking of distributed learning, I highly, highly encourage you to practice it. So this refers to the idea of spacing out your learning into several short segments over days or weeks. Now, the working memory varies by individual, but the average working memory capacity is about 3 to 5 items. So it will really serve you to break up a large task, like studying for a big exam or your boards, into smaller pieces. While you may end up spending as much time studying over days or weeks as you would studying in, for example, a 2-day library marathon, your learning will be deeper and you will retain the information more. So medical learning really is about long-term retention. So that's really critical and key here. The other thing is, in order to practice distributed learning, you need to start early and you need to make a schedule. And that schedule really should be detailed and specific, and it should be realistic. I also encourage you to schedule in breaks. It will improve your performance. Studies show that nonstop attention on a task actually hampers your performance. And even if you take a short break, it's been shown to increase your focus. Your brain really needs those breaks to synthesize and process and make sense of the information that you're taking in. It's also really important to identify when and where you study best. So make a schedule that's in tune with your circadian rhythm. You need to understand when you are most productive during the day. For example, it's been shown that your mental performance tends to crest in the late afternoon. So you may want to focus on doing comprehension like studying during that time. You also want to consider your study environment. Some people do really well with complete silence. Other people need a little bit of background noise or some soft music. You want to, though, eliminate other distractions. So multitasking, for example, answering text while you're trying to study, has been shown to increase the time you need to learn the material, and it decreases the quality of your learning. You also want to consider your ergonomics, right? So think about the lighting in the room you're studying, think about the chair that you're sitting in. Now, all of these things may take trial and they may take effort to figure out, and they may change over time. But I encourage you to make the investment in the time to figure these things out because they really do matter and they have an impact long term. So let's go ahead and now shift to talking about specific learning strategies that you can implement. Now, rote memorization is going to seem intuitive. It may even seem like it's appealing given the large volume of fast-paced information that's coming at you. And so say you do cram for an exam, maybe you even do well on it, right? But the question is, how well do you remember that information afterwards? It's a short-term solution. And medical learning is really about constructing a picture. It's about looping concepts together and building on them. It's an ultra marathon. It's not a sprint. So we really want to arm you with strategies that help you retain information longer with less investment of time. There's a whole slew of specific learning strategies out there, ranging from memory palaces to test-enhanced learning. For today's talk, I want to focus on 3 of them. These 3 have been proven by evidence to improve your retention of information. So today we're going to focus on spaced repetition, then interleaving, and finally talking about test-enhanced learning. So spaced repetition, I think one slide back, Laura, I think we skipped one. There we go. Yeah. So spaced repetition refers to this concept of reviewing or revisiting information at increasing intervals. It's been proven to decrease the amount of information you forget and to improve your retention. Now, this learning strategy has really been proven by the test of time. It was first described in 1885 by a German psychologist. So he described what's called the forgetting curve. So when you first learn something, it's stored in your working memory. If you don't review it, it has an exponential decay in that information. So you very quickly forget a large amount of that information, and then there's a slow and steady decline in your retention. Now, if instead you review or you actively retrieve that information at increasingly spaced intervals, it accomplishes a couple of things. It flattens out that forgetting curve, and ultimately, that leads to having better long-term retention of material. Now, spaced repetition is all about timing. The optimal time to be reviewing material is just as you're naturally starting to forget it. Now, that can be really hard, right, to precisely pinpoint, but a general rule of thumb is this. Review information that's new and less familiar at shorter intervals, and then gradually increase those intervals as you become more familiar with that information. And it's not just about rereading the same information every couple of days. You really want to mix up your learning activities. So, for example, if you study on a topic, a couple of days later, test yourself on that topic by doing practice questions or using flashcards. You then want to prioritize the repetition of questions on information you got wrong rather than the repetition of questions on information you got right. So not only will this overall strategy help you in terms of your long-term retention, it's also going to reduce your studying time because now you're not going to be spending time revisiting information that you can already reliably recall. Now, I know all this sounds really complicated to a lot of you, but the good news is learning resources more and more are using computer algorithms that optimize spaced repetition for you. So for example, they'll push out questions at an optimal time, and those questions will be based off of analytics, questions you got right versus questions you got wrong. We can go to the next slide. And the other good piece of really good news here is that there's evidence that this is effective and it's worth the effort. It really does work. So in one study, they found that without spaced repetition, medical students forgot a third of their basic science knowledge after a year. After 2 years, they'd forgotten over 50% of that knowledge. Now, that's a huge amount of information that you're going to have to spend time and effort relearning. We want to mitigate that. So spaced repetition really will help you with that retention piece. It's also been shown to improve efficiency. In one study, it improved learning efficiency by up to 40%. Now, I really understand that it sounds really challenging and frustrating to review material right as you're forgetting it, but it's supposed to be. The act of retrieving knowledge actually reforms that information in your mind, and spacing out that retrieval over time causes cumulative gains in that retention. So this process really facilitates lifelong knowledge, and that's really important and really impactful for you. So the next strategy we're going to move on to is a concept called interleaving. It's a fancy word for saying mix up the order of topics when you're studying them. Among other things, interleaving has been shown to improve retention. So say you're making your study schedule for an exam. You could set aside big blocks of time for each concept you're studying. So you could say, I'm going to study topic A until I'm proficient. Then I'm going to move to topic B until I'm proficient, and then I'll go to topic C. But research shows that there's a better way to learn, and that's by interleaving or mixing up what you're studying. So you want to cover a little bit of each topic in each of those study sessions. One back, Laura.
One more back? Okay.
Yeah.
There we go.
There we go. Yeah, thanks.
Got it.
So with, for example, so say you are trying to learn the classes of medications that are used to treat hypertension. Instead of trying to study and learn everything there is to know about ACE inhibitors and then moving to everything there is to know and studying everything about calcium channel blockers and then diuretics, mix things up. So study ACE inhibitors, then go to studying calcium channel blockers, then go back and do some questions on ACE inhibitors, then go and visit diuretics. You may have noticed that just like with spaced repetition, I mentioned questions here again, and we'll come to that a little bit more in a little bit more detail shortly about why I keep harping on questions. But for right now, let's just focus on the interleaving concept. Why should you do this, and what does it accomplish? So when you just focus on one topic at a time, like you do with blocking, you end up just focusing on a singular concept. You're not thinking about how concepts are related to each other. And so most of that information ends up staying in your working memory, and it's easily forgotten. When you interleave, your brain has to function and figure out how concepts are related. It has to retrieve information from your long-term memory. You have to make comparisons. And to make comparisons, you have to make links or connections to previously learned information. So by using interleaving, you will have a deeper understanding of the information that you're studying, and you're going to retain that information longer as well.
Don't know why it keeps jumping here.
No worries.
There we go.
And just like with spaced repetition, there's a lot of evidence behind interleaving. So it has been shown to help you remember things longer. It's been shown to help you remember things more quickly. And more importantly, interleaving has been shown to increase your ability to apply knowledge to new real world settings. So just as an example, in one study, they found that medical students who used interleaving to study electrocardiography were better at reading EKGs in real time than those of their counterparts that just used traditional blocking. So again, I know that interleaving sounds like it's challenging and it's frustrating. It requires organization, and it can be challenging in the short term, but it leads to better long-term outcomes. And let's move on to our third specific learning strategy, and that's test-enhanced learning. This refers to the concept of answering questions as a part of your studying. And among other things, it also improves your retention. So there's 100 years of research backing up the effects of and impacts of test-enhanced learning. And as you noticed, I already mentioned doing questions as part of spaced repetition and of interleaving. The reason that test-enhanced learning is so effective is because it's active. So when you read a textbook or reread your notes, you're really engaging with the material in a passive way. But real learning happens when you engage with material actively. So for example, when you answer a question, you have to search through your memory, right? And your memory is much more of a muscle than it is a filing cabinet. So the more that you practice answering questions and recalling information, the easier it's going to be to do so later, whether that's on an exam or when you're treating a patient. So the more time you spend self-testing, the more easily that information is going to come to you in those critical moments. In terms of how do you apply this, right? The answer is test, and then take some more tests. So take practice questions that are given out by your teacher. Find practice questions online and utilize resources that send out questions. As we said before, when you're practicing spaced repetition and interleaving, include questions in those practices. And this part is important. Review the answers to your questions, whether you got them right or whether you got them wrong. That's where the real magic is. It's been shown that that feedback mechanism enhances the benefits of testing. By incorporating testing into your learning strategies, you're going to have a better and deeper understanding of the information that you're trying to learn. And you're also going to cultivate a better mindset towards testing in general. And I want you to change your mindset about testing. Up to this point, I think a lot of us approach testing as something that comes at the end of a learning experience rather than something that's a part of it. But that's not true. Exams really aren't just for assessing your learning. They're an important learning opportunity in and of themselves. And just like the other strategies that we talked about, there's evidence behind the impact of this strategy. So there was a study that was published in the New England Journal of Medicine, and they looked at medical residents who tested themselves on information versus those who just reread information about that disease. The group that tested themselves scored on average about 13% higher on their exam. And that exam was given 5 months after they learned their information. So test-enhanced learning really does improve your retention. Again, like all the other strategies, it's challenging and it can be frustrating, right? Testing yourself and especially getting things wrong as you're trying to learn about them can be really frustrating. But it's really important that you try to do it because it's beneficial. It's really preparing you, not just for your exams, but for your patients later on. So the key takeaways I want you to take away from this topic of study strategies are to really figure out what works best for you and what works best for each of your courses. So assess and revisit the idea of your learning and your studying style. And then I want you to implement strategies that best set you up to learn the required material. The specific strategies that we talked about are what we like to call desirable difficulties because they're difficult in the short term, but they really lead to successful long-term outcomes. So that's the other point that I want to make to you. keep the bigger picture in mind, that what you're learning and the information that's coming at you, it isn't just for a course or a specific exam. It's for your day-to-day career, and it's for your patients. So develop key study strategies early on, because you'll be able to use them throughout your entire career. And with that, I think I'll pass back to Laura to go through healthy habits.
Great, thank you. Okay, so we're going to go ahead and launch another poll right now. And since we're going to be talking on the topic of healthy habits, we wanted to find out how much sleep are all of you getting per night. So we have some different options up there, and we'll give you guys a few minutes to respond and let us know how much sleep you get on an average night. Okay, it looks like we've gotten a number of answers coming in and the results have popped up. And it looks like that about 13% of folks get less than 5 hours of sleep a night. 68% get only 5 to 7 hours of sleep a night, and 19% get 8 or more hours per night. So while that's quite typical, I think, of a lot of folks, and particularly a lot of students, I'll be talking about some of the reasons why you might want to try and prioritize getting a little more sleep every day. So this section of the presentation is about 4 foundational areas for success in school. Now, the whole idea of wellness and how that relates to being a healthy student and avoiding burnout is one that could be an entire presentation in and of itself. I'm just going to be talking about 4 different areas: sleep, activity, nutrition, and social support, and providing some research-based specific strategies that you can use to improve your success by incorporating healthy habits into your days. So we'll go ahead and get started with those. I tried to do the research so that you don't have to dig through a bunch of research on these topics. And let's see if I can get the, So we'll start out with sleep. And why is sleep important for academic success? There were a lot of studies that I found that showed that longer duration and higher quality sleep are directly tied to higher GPAs. One of the interesting studies was one that said if you have 2 consecutive nights with less than 6 hours of sleep per night, you're going to have significantly decreased performance for up to 6 days. So you will have a strong impact that you won't necessarily recognize, because insufficient sleep also impairs your ability to monitor yourself. It's hard to tell that you're impaired if you aren't getting enough sleep. So getting enough sleep is important for you to recognize how you're doing and to be able to successfully get through your material and to learn well. So what can you do to try and ensure that you can get enough high quality sleep? And most of these things are sort of self-evident and obvious, but they are proven techniques to ensure that you get good night's sleep. One is to stick to consistency, consistent schedule. You want to try and go to sleep and get up at roughly the same time every day. You want to try and set up a wind down time before bed, ideally without screens, where you're calming yourself down, you're getting yourself ready to sleep and trying to calm your brain down. And you also want to try and avoid caffeine for about 6 hours before bed. Caffeine has a fairly long half-life, and you want to try and make sure as much of that is out of your system as possible before you're trying to fall asleep. You also want to make sure your sleep area is set up for comfortable sleep. So you want to avoid light using an eye shade or using the light blocking curtains or shades. You want to make sure that it is a quiet environment, or if you can't have a quiet environment, that you're using something like a white noise machine or earplugs to either mask noise or prevent the noise from getting to you. You want a good temperature, so ideally a cooler temperature between 65 and 72 degrees Fahrenheit. And you want to try and avoid any distraction. You want to turn off the notifications on your phone, ideally like flip your phone upside down so you can't see if those texts are coming in. you want to try and keep that away from you so your brain doesn't stay active. One thing that has been shown to be correlated with higher grades is short naps. Now, a short nap doesn't mean taking a 2 or 3 hour nap on the afternoon. Oh, I'm so sorry here. It looks like this has popped up and I will get rid of it. Okay, hold on for just a second. We're going to go back into here. Let's see. I'm going to